Andrew Douglas here in the Action News 5 Digital Desk. There's some new research out there that shows a key role that immigrants play in 13 states when it comes to healthcare. We know healthcare is a growing industry and it is going to continue to grow, and so there is a constant need, a demand for workers in that industry. Let's bring in Steve Hubbard with the American Immigration Council to discuss more about these recent findings with this research. Steve, good morning. Tell us more about this research.
Yeah, so we looked at immigrants and how important they are to the healthcare system across 13 states. And of course, Tennessee was one of those states that we looked at. And we wanted to ensure that we looked at healthcare practitioners, and these are medical doctors, nurses, medical technicians, and how important they are to the healthcare system within Tennessee. And we found that within the healthcare system, that 5.9% of healthcare workers, healthcare practitioners were immigrants to this in Tennessee. And more specifically, physicians, it was 18.7% of physicians and surgeons were immigrants within Tennessee's healthcare system. So overall, when you're looking at shortages in the healthcare system, it's important to think about how the important that immigrants play in the labor force within Tennessee's healthcare system, and specifically looking at policies and other areas that encourage immigrants to come to the state, and for immigrants to stay in the state and work within the healthcare system.
There was a lot of shortage of workers on so many different industries for the better part of a year or so. Is there a shortage of workers needed in the healthcare industry? And if so, how are immigrants meeting the demand there?
So when we looked at the overall increase in job postings, of online job postings, we compared 2017 to 2021, and we saw the increase in job postings rise about a little over 30% for healthcare practitioners. And so that shows that there's a demand, and some of the specifics, when you looked at specific occupations, you saw even higher increases, even things like over 500% increases in job postings for opticians, 80% for dentists. So there seems to be, when you're looking at the job demand within Tennessee and as well as other states across the country, you're seeing a great demand for job postings and those occupations.
This next stat I thought was a no-brainer. The demand for bilingual healthcare workers is on the rise. Tell me about that sector.
Yeah, we're seeing that, of course, all over the United States. In Tennessee, we saw an increase in bilingual. When you looked at the job postings and they required bilingual communication skills, that increased over 200%. In the number of job postings. So that is an important skill that is needed. Of course, when you look at immigrants, many times they, of course, if they're coming in and if they're Spanish speaking or another, French speaking or what have you from their country, they already have that skill. Of course, they already have that bilingual skill, that language skill that makes them, attractive for those type of positions.
Okay, and then I understand there's a growing need for healthcare workers in several different states, but in some cases, I'm understanding they can't practice in the state. Tell me more about that.
Yeah, so it's sometimes you will have someone who has been trained internationally from another country, and maybe they can meet our standards of meeting those requirements, but they do not specifically have a U.S. medical degree, but they meet the standards, the board standards. They are comparable to other physicians in their skills, and sometimes they can't practice. And we've seen that in states have moved policies, for instance, in Minnesota and Washington, have moved policies to encourage internationally trained medical professionals to work in the state as long as they meet the requirements of needed to practice medicine or to be nurses or what have you within the state.
Hubbard. Steve Hubbard, American Immigration Council. We really appreciate these new findings from this research. Thanks very much for coming on the Digital Desk.